Thank you for joining us for today's conversation on COVID-19 and pregnancy. Here at Novant Health, our goal is to deliver the most remarkable patient experience in every dimension, every time. We recognize with the recent news of COVID-19 in our communities and around the world, many expectant mothers had lots of fears and wanted to know what was fact versus fiction. And so our goal today is really to be able to talk to all moms as they come into our facilities to know that here at Novant Health, we are taking every precaution to keep both you and your baby safe. I'm so excited today to be joined on this Zoom conversation as we're practicing social distancing by someone as well as one of our Novant Health patients who's also an expectant mom. Our first expert is Dr. Jaleema Speaks. Dr. Jaleema Speaks is currently an OBGYN located here in Winston-Salem, North Carolina at Novant Health Woman Care. She was born in New York, but has lived in Winston-Salem since 1994. She attended Wake Forest University School of Medicine for medical school and stayed there for her residency, which she completed in 2012. When she's not caring for patients, Dr. Speaks enjoys spending time with her husband and 2 children. Thank you, Dr. Speaks, for joining us today.
Thank you, Ashley.
Our next expert is also an expectant mom, Dr. Froelich. Dr. Stephanie Froelich received her medical degree from the Philadelphia College of Osteopathic Medicine and completed her residency in Philadelphia, Pennsylvania. She's been living in North Carolina for several years and also opened our newest OBGYN clinic in NODA, the North Davidson area of Charlotte, NODA OBGYN. She has a special interest in high-risk pregnancies, narcotic management, and minimally invasive surgery. She lives in the Elizabeth area of Charlotte with her husband and her almost 4-year-old son, Robbie, and her 2 rescue pet bulls. She and her family are excited to welcome their baby girl in July of this year. So thank you, Dr. Froelich, for joining our call today.
Thank you, Ashley.
And we have Molly Cruz. Molly is one of our Novant Health patients. Molly is also on the way to having a baby girl in May. She and her husband both met while they were both working for a local tech startup called Passport. They got married in 2018 and moved to Belmont, North Carolina, almost a year and a half ago, where they bought their first home. And they are excited to be welcoming their baby girl soon. So Molly, thank you for joining us today.
Thank you.
So I'm so excited to have all of you all with us. And we're really just going to talk today just about the conversations that women are having. Women are calling their OBGYN and they're wanting to know, what should I do and what shouldn't I do? And so to kick off the conversation, Molly, as an expectant mom, I know you have several questions and we talked earlier today. I'll let you go ahead and get started.
Yeah, so my first question is, are pregnant women at higher risk?
Molly, that's a great question, and I know something that's been on a lot of our pregnant moms lately. Current available data on the COVID-19 suggests that pregnant women are not at an increased risk. However, in the past, pregnant women have been at greater risk for these kind of infections like influenza and SARS, which is why the CDC is still classifying pregnant women as a high-risk group. Just because as this continues to evolve, we just want to be cautious about the data that we receive. But currently, from the limited data we have, it doesn't look like pregnant women are showing any increased risks as far as we can tell.
Okay.
Yeah, and I think that's another great question, because I've heard my friends and other patients have asked, like, does it matter what trimester I'm in? Dr. Speaks and Dr. Froelich, I know you all see women at all trimesters and at all stages of pregnancy, but is that a key factor as well?
Well, for recommendations for taking precautions to trying our best to avoid infection, they're the same in pregnancy as well as for those who are not pregnant. Specifically, washing our hands correctly and well and frequently, avoiding people who may have signs or symptoms of illness, and also practicing social distancing and other guidelines that are brought forth by the CDC and our local officials. And those recommendations are regardless of where you are in your pregnancy or what trimester you're in.
Yeah, I think you bring up an excellent point, Molly. We were talking earlier about just COVID-19 and pregnancy, and I know you had a question specifically about that.
Yeah, so what would happen if I got COVID-19 while pregnant?
It's a great question, Molly. So with our recommendations, we use both the CDC and ACOG's guidance. ACOG's kind of like the OBGYN's governing body. And so there's this really great algorithm that we would follow to kind of assess your symptoms, assess for your severity, and see whether you could be managed safely at home or if you could be managed as a outpatient, sorry. And so we would use those guidelines in accordance with that. And then if it was at the time of delivery, all of our hospital systems in the Novant system have been doing great care to make sure that we have specialized delivery rooms for our patients and allowing them to safely deliver in our setting. So that way we can make sure that the safety of you and your infant during that delivery process and postpartum process as well.
Yeah, so if a mom were to test positive for COVID-19, could that be transmitted to her unborn child?
So currently, our understanding about COVID-19 regarding its transmission from mother to child while a mom's pregnant or in utero suggests that that doesn't happen. There's ongoing studies to determine exactly if that is the case, but there have been small numbers of pregnant women that have been studied who've had COVID-19 during pregnancy or at delivery, and it is not felt that it was transmitted through the mom's blood, through the placenta to baby.
Okay, so let's talk about a little bit after delivery. So we've had a delivery and moms probably have questions. And Molly, I know we were talking just about making sure that the baby is safe, but you had a specific question around breastfeeding.
Yeah, will it still be safe to breastfeed?
So our current data suggests that it's not transmitted in breast milk, but more so that the risk would be if you were COVID positive, the respiratory droplets transmitting to the infant. So it would be kind of the same recommendations we would use as far as mom would be wearing a face mask, making sure that she's washing her hands. Ideally, it is challenging in the beginning, but considering possibly doing pumping, and then having another caregiver feed the infant. But that again, would be a personal discussion we would have between the mom and how with pediatricians as well to see what the best plan going forward would be given the current data.
Right, and one of the things you touched on earlier, Dr. Froelich, were the precautions that we're utilizing here at Novant to reduce the exposure. Can you go into a little bit more about that and how that will affect the delivery process, or if all, for women that are coming to deliver at Novant Health?
Yeah, so with Novant Care, we've been having, we still value that it's really important to have a support member present for delivery. We think bringing life in the world or anything that you have to go through OB, it really matters to have someone there to kind of share with you. Our staff takes wonderful care. Our nurses, our physicians, our midwives take really good care of our patients, but it's nice for you too to have that personal level of support. So we still are allowing one support person with patients. That one support person will have to be the same throughout their entire stay, and it has to be a healthy adult. And so we're trying to avoid obviously more people coming into the hospital. Also as well, during with our visitors, we are, adhering to the new CDC guidelines of, having them with masks. And during labor, we will have the mom be pushing with a mask on. And all of the staff in the room are now donning masks, that specific N95 mask as well. So it sounds like you're a little bit underwater, but it's a good to at least, have that protection so that that we as providers who see patients, we're not transmitting to, people as well that are in labor and delivery and elsewhere.
Right, and we're so grateful just for our clinical staff. And then last week was National Doctor Appreciation Day. And so I just want to say thank you to you, Dr. Froelich, as well as Dr. Speaks, for all you're doing for our patients during this time, as well as taking care of your own families. I mean, this is something that we've never been a part of. None of us have experienced it. And so just as colleagues and team members, we say thank you for all you're doing.
Thank you.
Thank you.
And something that you touched on, and I'll ask Dr. Speaks this, what procedures should women adhere to when they come home from being in the hospital to decrease the risk of the well family being susceptible to COVID-19?
Sure, Ashley, that's a great question. And we would want you to take the same precautions coming home from the hospital as you would from other essential visits that you have, whether that be your doctor's office or even the grocery store. So washing your hands immediately, avoid touching your face, and if you do, wash your hands after doing so, using Kleenex if you sneeze or need to blow your nose and discarding that right away, keeping surfaces in your home clean and disinfected frequently, and practicing social distancing, avoiding outside visitors to your home, which we know is very hard with a new baby coming home. But just really keeping up to date with your local recommendations as far as keeping social distancing practices up.
Yeah, and I would say, I know whenever you have those little bundles of joy, everyone wants to come and see, but for now, it's probably best to do some Zoom or Skype videos with visitors. And Molly, I know we were talking, and I know you had another question that you wanted to ask our doctors as well.
Yeah, so what can pregnant women do to stay as healthy as possible during this time?
So, doing your normal recommendations as pregnancy would be, as far as eating healthy, we all, I myself right now love the carbohydrates, trying to take that in moderation as best you can. We've all kind of joked about the quarantine weight gain. So just sure, even though you are stuck in the house, that you're trying just to snack healthy. And also, it is really still important just for pregnancy mood and everything to get out of the house in a safe, way, walks around. We're fortunate to be in North Carolina. The weather is really pretty, so you can get out, do some daily walks, again, while trying to keep that 6 feet of distancing from people passing by. And just trying to stay exercise as well. That's another issue too. Pregnant women already, we kind of slack a little bit on the exercise, but exercise has shown to be really helpful in pregnancy. So trying to find kind of a new normal routine if you can. I know a lot of yoga studios are doing like online yogas that you can log into. So still trying to make some time to kind of keep some routine as best you can while trying to, adhere to the current guidelines.
And I thank you both for that. Are there any closing, as we get to our closing, just Dr. Speaks and Dr. Froelich, any other advice that you would give to moms or people that are even trying to conceive during this time, and just a way to kind of stay calm as well as just being informed? Any other advice that you would share?
I would say feel free to reach out to your OBGYN providers, to your office where you receive care, not just for questions pertaining to your physical health, but we know that all of the social changes we're experiencing and being disconnected from physically, at least, from our loved ones and our support systems can be quite challenging. So let's not forget the emotional aspect that is being deeply affected by all this change, and just reaching out for help if you're having difficulty with coping with some of these very new and unprecedented changes.
Yeah, and Dr. Froelich, I know as a new mom, as the second baby that's coming to the house, anything that you've been practicing that you would share?
Yeah, I completely agree with Dr. Speaks. It was great. Dr. Speaks and I got to chit chat over the weekend, and kind of, it was nice to just talk to people, especially both female OBGYNs with young children at home, kind of going through the same situation of, going into the hospital still and staying safe. So, it's always important as OBGYNs, we are always here for you. We know that there's so much you can get on social media nowadays, and especially everything that's going on. We too, most, OBGYNs have the similar situations or can relate with you. And so if you're getting anxious about anything, especially, what are you going to do when you have to come back to the hospital and telling grandparents, no, you can't come visit or things like that. Reaching out and not staying isolated despite the social distancing is really, really important. Dr. Speaks and I talked too. I didn't think about, if this is still going on in July, who's going to watch my child? And it's things like this that I think we're all starting to kind of figure out what the best is for each family. And so I think that's, always a great discussion to see, what you can do to kind of just start to kind of plan ahead and see what works best for you and your family.
Thank you so much. And Molly, thank you for joining us. As a Novant Health patient, we're so excited for you and your new bundle of joy and your family that's going to come. So we're just glad that you were able to join us today and get some of your questions answered.
Thank you. Thanks for having me.
And so I want to thank all of our panelists today for our conversation about COVID-19 and pregnancy. As always, please feel free to reach out to your healthcare professional with specific questions. And for questions about Novant Health, please visit our website, novanthealth.org, where you can find out more information about COVID-19 and what we're doing to keep all of our community, as well as our patients, providers, and staff safe. Thank you for joining us today.